Okay, I'm going to be going over week 7 right now, and here's my desktop. You should be able to see that. We're covering tobacco this week, and I'm going to be talking about cigars, e-cigarettes, cigarettes, and some other things. You'll see the PowerPoint is posted here. Information on cigarette smoking, cigarette butt information about how it's not biodegradable, and it is considered trash. And so that's something we're going to cover. I have a youth tobacco use CDC link that's also embedded in your discussion post. And you'll notice this week that I put the discussion post and assignment together. And I'm asking you to do a little bit of research inside your discussion post and respond by asking questions of other people. We're kind of doing this thing where you're going to use your assignment and your discussion post together and ask, questions to kind of go deeper into the matter. So make sure that you take a look at that discussion post and you do it before the deadline of October the 8th. Last, I have the chapter review for tobacco in here. I put it so that it's absolutely clear that although it has an October 8th due date, it is open till December 1st. Your discussion post assignment closes on October 8th at midnight and is worth 15 points. Your chapter reviews, all of them are suggested deadlines, and those do not close until December 1st. So I just want to make that super, super clear that you should always get your discussion post assignment for each week in, and that you should always work on your chapter reviews ongoing, take them multiple times, try to get your highest score. So let's go ahead and get started. I'm going to go over this PowerPoint, and I'm going to also give you some information that you can use when you're using in your discussion post. So we're going to be talking about ending tobacco use. You should know that tobacco use is directly correlated. It has a strong correlation with cancer. It's one of the few things that you can say, if people smoke, their chances of getting cancer are very high. And one of the first questions you should ask is, what's carcinogenic? What is in tobacco that makes it carcinogenic? And the answer is, do you know it? It's the tar. It's a tar that's in tobacco. What's the addictive thing inside cigarettes that makes people always crave it and it's immediately addictive? The answer is nicotine. So carcinogenic, the cigarettes are extremely carcinogenic, but we're also going to be talking about other items too. So for example, cigars, are they carcinogenic? Yes, very much so. In some cases more than cigarettes. So here in Kern County, our rates are at 21%. We actually have a higher rate of smoking than the rest of California. So the average adult in the United States is 19.3, and in California it's 12.1. These rates continue to go down because here's the thing that works the most with getting people, especially youth, to quit smoking. And when I say youth, I mean under age 25, early adults. It's cigarette taxes. So what we start to do is we up the cigarette tax to help offset the cost of the annual health care cost, which are in the billions. And then tobacco industry is marketing in the billions. And so I can tell you that the cigarette tax does not make up for all the costs that it puts on health care. So here's the big thing is that you need to know that the tobacco industry has to replace the smokers. Because if people, if I go back to this, are dying of cancer, and the correlation, I have a fact I've read many times that 80% of people who start to smoke, their chances of getting cancer are that high. So if people are dying of smoking and getting cancer later on in their life, and a lot of it, lung cancer, heart disease, because your lungs can't work and function, so it puts stress on your heart, and other types of cancers, then they need to replace their smokers with young smokers. And so teens are often targeted to begin smoking. And one of the big things that you need to realize is that smoking is a gateway drug. It opens up to other high-risk behaviors too. So a teen that smokes they're 6 times more likely to get into alcohol and other drugs, to carry a weapon, and engage in unprotected sex, and tip more at-risk behaviors. So it's one of those things that people go, oh, they're just smoking. No, it actually opens up to high-risk behaviors. It is, the research has shown it over and over again. So I'm going to tell you that I teach about drugs, a lot of different ones out there, a lot of different things out there that that people can become addicted to. But look at all the different, these things on the left side are all the different neurotransmitters that are out there, and look at how cigarettes impact, and specifically nicotine starts to impact, and what it does across the body. It hits, and you might say these are other drugs that I'm flashing up here and what they do. So heroin pulls off and hits 2 of those neurotransmitters. Cocaine hits 3 of them: dopamine, norepinephrine, serotonin. Nicotine hits all of them. So when someone begins to smoke or do e-cigarettes or cigars, they're taking in nicotine, and nicotine is highly addictive. It hits all these different neurotransmitters, and if you think about, look at this one right here, vasopressin. That one actually increases memory. So this is an addiction that can actually help people remember things. The problem is that it starts to interfere with our chemistry in our brains, and we become addicted to it, and our body starts to change. It's a very highly addictive, psychoactive drug. It's changing the chemistry in our brain. So one of the things that people can do is they can contact the American Lung Association, and they actually have sensation classes. And this is something that they do at the K through in high school. Is they do 10 weeks of health session. They give health credit for it. They have a facilitator training, and they have evaluation to track people. So this is something that can be offered here at BC, and the BC does have sensation classes, but this is something that if you think, oh, what are some of the solutions that we can do here on campus to help people get off tobacco? Here's something to think about. You have to understand, why do people even begin to smoke? Well, the biggest reason why people begin to smoke, and this is a survey that was done with college students, is that it reduces stress. So if you flash back to that PowerPoint slide before, and it's hitting all those different areas, dopamine, serotonin, epinephrine, all those different things, it's helping people concentrating, then you could see why they want to reduce their stress. Some of it is attributed to social pressure. So like people, when they start to hang out with smokers, they feel pressured to smoke. A lot of people talk about the fact that they can't smoke. Some people start just beginning by experimenting, and then again, this concentration thing pops up again. Oh, and I have to say that it does control appetite, because one of the things is that once they quit smoking, on average, they gain about 10 pounds, because smoking does suppress appetite. Some of the things you need to know about is that there's something called environmental tobacco smoke. And so this is a big thing. And this is the reason why there's no smoking allowed on BC's campus now. Exposure to secondhand smoke is as harmful as smoking itself. So when people are walking through clouds of smoke, they are inhaling everything that smoker is inhaling. They're getting exposed to all the carcinogenic effects. And to the non-smokers, you do have rights. And it's considered And in fact, it very dangerous. And for this reason, that's the reason why policies have been implemented to ban smoking on airlines, ban smoking in restaurants, ban smoking in bars. And where this came about is that the workers had to work there, and it became an occupational safety hazard. Because smoking does put things out into the air and make it very dangerous. One of the things that people need to understand that infants and children are very susceptible to environmental tobacco smoke. That's very high risk behavior for anyone under 1, especially under the months of 6 months. Their chances of getting sudden infant death syndrome increase substantially with smokers in the house. Children who have smokers in the house get ear infections, sinus infections, and far higher rates than non-smoking households. And that goes for apartments that have smokers in it too, because apartments, smoke travels between rooms. It doesn't matter that one room is smoke-free. It gets into the walls and it stays in there. So you need to know that that smokers who enter treatment programs are able to quit 20 to 40% of times. And there's such thing as nicotine replacement therapies, they're prescription drugs, and they're even experimental vaccines. So when you're answering your discussion question, you can refer back out to this about what some things that can be done. Here are all the things to expect when people quit. They will get irritable. They will have fatigue, insomnia, coughing, poor concentration. Basically, everything that the drug did before, when it's taken away, the body has an opposite effect. They lose concentration. They become hungry. They start to get headaches because before it was a vasopressin, but now they have an opposite effect. They start craving it because they want the nicotine. And it's very acute, but research says when you go out to CDC, the link there, that if people quit, they can actually start to dial back the effects of the carcinogenic effects of the tobacco. So what's the story with e-cigarettes? Are they as dangerous? Now, one of the things is they say that e-cigarettes helps people quit smoking. That's great. But the problem is that e-cigarettes still have nicotine in them. And so when people are using e-cigarettes, they're still getting that nicotine fix. And in some research I've been reading, they actually say that in order to quit, you have to have a certain dosage to wean yourself off of nicotine. So why would someone want to get hooked onto nicotine? And that's what happens with e-cigarettes. You know, they have nicotine, they have other chemicals and ingredients in them that can be addictive. And that's something to be very wary of. So you could start to see that it's starting to become prevalent. You could see it went up in 2012, and I bet you the rates are even higher today. I need to pull some stats for 2017, and if you can go pull those stats, that would be great. But you could see, well, I start off where I left off. One of the big things you need to realize is e-cigarettes is toxic. The liquid is toxic. So I'm going to go ahead and go there. And so the next thing this is all the different things that can be involved in there. There's nicotine in it. It has a lot of different effects that are listed. These are all the liquids, all the different metals and items in there. It has a lot of candy flavoring. So we found that the poison control number has been used a lot more because children sometimes mistake this and drink it. And so here's some things you need to think about. This is the consumption of it. These are all the chemicals in it, and all the yellow are considered harmful to the FDA. So e-cigarettes are definitely putting particulate matter and pollution out there, and these are some of the things from lead to different things. And so it's just not a vapor. Yes, it's carcinogenic, but what they found is that it has 7 times more particulate matter. This is an item that gets embedded in your lungs and can impact you. And then still in a room of 5 or more e-cigarette users, nicotine particulate matter levels are above healthy levels. So when people are blowing out the vapor, it actually starts to become more dangerous. So they have found that after 5 minutes of use, e-cigarettes had an immediate adverse effect, similar to the effect seen with tobacco smoking. So there's a lot of, a controversy go out there saying that e-cigarettes are healthier. Yeah, in some ways they are, but they're being used more, and the research has not come back to say whether they are a good replacement. So be wary of e-cigarettes. So here's the thing is that why quit? Well, the thing is that you can, once someone quits, they can start to repair immediately. So here's something to expect with quitting. After 20 minutes, the blood pressure drops to normal. After 8 hours, the carbon monoxide level in blood drops to normal. After 48 hours, nerve endings start to regrow. And after 15 years, risk of heart disease is the same as that of a non-smoker. So it definitely benefits people to quit. And so here's some more facts for you. So quitting is worth it. And then here's something to think about too, is that one of the things is that people could use patches and different things to start to do that, and also get into behavioral therapy. Here's some other things, nicotine patches and things like that. I also want to put out that cigarette butts are considered littered. If you look around BC's campus, you can see the remains of cigarette butts. I would love for you to go and walk around and see when you're on campus, if you're on campus, to look at cigarette butts, or look down and see where you see cigarette butts. They're not biodegradable. So we are now tobacco free, and I'm curious to think about how you think that's going. I'm also curious to see what you think about youth not smoking. I want to tell you that if a person does not smoke by the age of 25, research has shown that their chances of ever smoking are less than 4%. So when we take tobacco, BC, a tobacco-free campus, we're actually encouraging people not to smoke, not to get addicted to e-cigarettes or to tobacco or to cigars, and their chances of them ever picking up that habit after 25 are really low. So I'm curious to hear what your thoughts are on our discussion question. I'm also curious to think what you think about marijuana. Is that replacing tobacco in a sense of people think that that's herbal and less dangerous, but the reality it isn't. So take a look at that discussion question, which is worth 15 points this time. It's both a discussion question and an assignment this week. So we're not going to go outside because you are going to go out, tell me what it's like around your area, and tell me what you think. All right, so that's that. And now I am good. I'm going to end the meeting. And I look forward to any questions that you may have this week.